Believe it or not, you spend about as much time at work as you do at home.
No.
And if you work in an environment that has potential safety hazards, it is important to be aware of them and protect yourself from these hazards.
Wait!
There are a lot of hazards that you could run into if you work in construction or factories, but for now, let's just focus on poor air quality. Poor air quality, whether it be indoors from machines or tools, dust from mechanical processes, outdoor pollution, or even gas exposure, can all have severe consequences for workers. As an employer, you probably already know that focusing on preventing these safety hazards is key to protecting your employees and reducing your OSHA 300 logged injuries. So why is air quality so important in the workplace? Well, it's a silent threat that many in the industry tend to overlook and don't do anything about until the damage is already done. To start, some signs of poor air quality is a very common respiratory condition called occupational asthma. The poor air quality can easily be identified if you notice chronic coughs, nausea, severe headaches, and/or diminished productivity. According to the American Lung Association, approximately 15% of all adult onset asthma cases are work-related. Wow, that means poor air quality mixed with allergens like dust, mold, spores, and even chemical fumes can trigger asthma attacks and lead to other symptoms like coughing and wheezing. If you have questions at any time about the air quality in your workplace or how we can help, just fill out the form below or call us at 1-800-551-9816. Now, another common respiratory condition is chronic obstructive pulmonary disease, or COPD. According to a study done by the International Journal of Environmental Research and Public Health, COPD is often caused by long-term exposure to indoor air pollutants. Some of those pollutants can include tobacco smoke, particulate matter, or volatile organic compounds, and all lead to a higher risk of developing COPD. When it comes to respiratory conditions, a lot of industries are considered higher risk. Those industries include construction, manufacturing, agriculture, mining, healthcare, and even food processing. In the construction industry, workers are typically exposed to airborne particles, dust, and toxic fumes that result from things like demolition, welding, and concrete cutting, which you probably see often when you're driving through construction zones. The manufacturing industry is a big one. Since there are so many products being made, there are a lot of situations where factory workers could be exposed to harmful substances like chemical vapors, metal fumes, and particulates, all of which lead to respiratory problems. The agriculture industry is another one, and even though farmers are typically working outdoors, they still need to protect themselves. They could be exposed to things like pesticides, fertilizers, and dust, which may cause breathing problems over time. It is no mystery that miners are at risk and could be breathing in coal dust, silica, and other harmful substances. Back in the day, coal miners did what they had to do to make a living, but did it without any protection, and many of them developed health problems due to heavy exposure in a short period of time. Healthcare is one that nobody really thinks about. These medical professionals could find themselves breathing in pathogens, biological agents, and hazardous drugs, all of which require some sort of respiratory protection. And finally, we have the odd one out, food processing. You wouldn't necessarily think it, but employees around flour mills and bakeries can often deal with poor air quality. So, as an employer, what can you do to limit the risk of poor air quality? For starters, you can reduce air pollution by making sure you have adequate ventilation in work areas, which will make sure all emissions are being dispersed properly. You could even go as far as installing an air filtration system with high-efficiency particulate air filters. A proper airflow or ventilation system can make a huge difference. From controlling dust to reducing gases, it all boils down to using the right technique to limit or eliminate exposure. For dust exposure, it could be the implementation of exhaust ventilation systems near the machines that are generating the dust, or even using wet suppression techniques, which consists of spraying water into the air that would weigh down the dust particles. For gases, after implementing a gas detection system, ventilation systems or ensuring proper airflow are crucial in reducing the concentration of the gases. In many of these workplaces, a respirator would be necessary. And if you have employees wearing respirators, they will need a respirator fit test to ensure a proper fit. If it doesn't fit properly, the mask would still be allowing all those harmful airborne particles to sneak by, and ultimately, you would end up breathing them in anyways. Now, respirators are on the prevention side, but what about the response to an employee injury? Well, when an incident occurs, a triage nurse can be your first contact. Here at CNS Occupational Medicine, we're staffed up with nurses that can help workers determine the best course of action after an injury by providing self-care instructions or directing the worker to an appropriate level of care. If you or your company is unsure where to start, or if you just have questions, just fill out the form below or email us at info@cnsocmed.com, or you can call us at 1-800-551-9816 and an occupational healthcare specialist will help you out.